Hello, everybody. Suzanne Connors Inc. with Dawning Visions Hypnosis here to speak about why therapists, you all, choose to break up with your patients. And there's a lot of different reasons why that may happen. And if it happens often enough, you find yourself not wanting to practice anymore. Some of the reasons would be because the clients aren't sober, so it's impossible to work with them. They don't really buy into therapy and what it's there to do to help them out. They are not invested in the work itself. Maybe there's an issue with rapport between the two of you. And maybe their situation is out of your scope of care or interest in doing the care. Now, what we need to really understand is that in all practices, there may be some people that we find ourselves working with who we don't really enjoy working with for any of the reasons I gave you, or maybe you have some of your own reasons. But whatever those reasons are, you really need to think about why we got into this work of doing therapy in the first place. And for most folks, it is because they really want to help other human beings live much better, happier lives. And yet, once they get into the practice, they find that it's not as easy as they thought it was going to be. So what can you do about this so that you can attract the people that you enjoy working with? Well, you need to first figure out who those people are. Many, many years ago, back in 1989, when I was diagnosed with bipolar, no longer have any of the symptoms, haven't for a long time, which is a good thing. The group therapy therapist was wonderful. And the reason she was wonderful with working with a manic depressive group, because bipolar was not even used back in those days, was because she was absolutely fascinated with how the bipolar manic depressive mind works and why so many of the patients with manic depression go off their medications, even when they had a lot more time feeling really depressed than they did feeling high based on their biochemistry. Now, she worked with all types of patients in her practice. She was working out of a community-based agency where I was going at the time. And so she had a lot of patients. And she was also a case manager. She was actually my case manager, and she's actually the person who made sure that I never got psychotic. They had me on so much lithium. Oh my God, it was horrific. But I was able to get my fourth psychiatrist to, well, actually, it was the third psychiatrist to lower the medications because it was just outrageously high and I just couldn't function at all. It was idiotic. And then the fourth psychiatrist, the one that I stayed with until I got healed by my neurolinguistic programming trainer, Ted James, worked really hard to get me to the lowest dose possible so that I could keep my high baseline of activity and abilities going while making sure that I didn't cross over into psychosis. And she really did a very, very wonderful job, but she couldn't heal the problem, and that was the problem. I really didn't want to be managed, and I didn't really want to be on medications for the rest of my life. I had a different idea. And so I ended up going to a very expensive, but I'd pay for it all over again, and I'd do it all over again in a heartbeat to be able to be free of the symptoms that made me basically crazy. And really unhappy 6 months of the year, and too ecstatic the other 6 months of the year. Having balanced emotions is a really good thing. So I want you to think about who are those patients that you really enjoy working with? Who are the people that you feel called to work with? What are their ages? What gender? Maybe it's both. Maybe you find a certain type of problem or illness more of a calling for you to do the work. Maybe in your personal life, you overcame a certain mental illness. We do know that most of the people who go into this work overcame their own issues, and that's what brought them into the work. So we don't need to pretend that that isn't part of our journey, because that is part of our journey, and we need to respect that part of the journey, especially if you're a person who is able to actually heal yourself. Because this is the other thing. We can have a lot of problems with patients. We haven't healed our issues, and we get triggered by them. Or we start being codependent with them in a really bad way, in terms of saying, oh, poor you patient, I feel really bad that you're stuck in this really lousy relationship with your husband, and he's a really horrible person, and yet you never met the man, so you have no idea what the reality is. That's a problem, because it's really about projecting the therapist situation from their past onto their patient, which is not going to help their patient heal. The way a patient heals is by understanding the dynamic, understanding how to change the dynamic, doing the forgiveness work, and then deciding whether or not it's a healthy enough relationship to build on and heal, or if it's really unhealthy and they need to leave. And only they can make that decision. We're just there to guide them to that decision. As an example, if you're finding that you're one of these therapists who has had a lot of trauma or has had a really long haul in terms of dealing with their own issues, I really want to invite you to take advantage of my breakthrough sessions, because in the breakthrough sessions, you will be able to let go of all that crap, and you'll be able to do it really quickly with the use of hypnotism and linguistic programming. I've been doing this work for 20 some odd years. I came to it as a result of actually working in the mental health system when I was chemically stabilized at that point in 1993, and decided that there's a real problem with the paradigm of pathologicalizing every single normal human emotion, which in years past, people actually were learning how to self-regulate their emotions, a much better way to go in my estimation, versus drugging everybody up with these chemicals that the body really doesn't know what the hell to do with. And to let the stuff go and have your own true healing happen. For the majority of my clients, it really takes a matter of 3 or 4 longer sessions. I don't do 50-minute sessions. I don't believe in them until all of the trauma and all the forgiveness work is completed. Then it's just a matter of helping my clients learn boundaries if they need to learn that. And if they have situations that they want to continue to work on with me, we do weeklies, and those sessions are shorter. But for the actual clearing work, that takes time, because I have to figure out exactly what is causing the general problem, the thing that is creating all the symptoms that gave the diagnosis in the first place, or diagnoses. Some people have multiple diagnoses, yeah? And then I have to figure out, or help you figure out, what your objectives are for the treatment, because it's not only about letting go of the symptoms of the emotional issues one is contending with. That's about 20%. 80% of the treatment is actually helping you live into your compelling future to create a life that is really fulfilling and contenting. What is the word? Where you have a lot of contentment in your life. That's what I'm trying to say. Because we can all achieve that. But we can only achieve that if we actually are real with ourselves and actually do the really deep work that so many people, including our patients, may not want to deal with. And yet, if you're in the world of therapy and you are providing therapy, you best deal with your own issues first. Because once you do that, it's much easier to hold your patients accountable to do the work that they need to do, because therapy is work. And to be able to truly be present for your patients in the way that they need to have you be there for them. And really, a large part of it, as far as I'm concerned, is holding them accountable to do what they need to do the things that their subconscious mind tells us they need to do. And in so doing, the healing occurs. And that means sometimes doing things they don't want to do, like having hard conversations with people in their lives, which usually are not anywhere as bad as what they conjure up in their minds when they actually go through it. And relationships generally go deeper, or they realize that's not a person they want to have in their life anymore. And that's perfectly great because it's called having healthy boundaries. So if you're interested in learning more about my breakthrough sessions, I will leave my contact information below. I also do training, 2-day VIP trainings for licensed mental health professionals. And again, my contact information will be below so we can set up a video call to talk about it. With the 2-day VIP, I include a 12-month mentorship so that you can actually learn as you practice how to actually use these tools and techniques that you learn in a 2-day VIP program correctly and in the right order, so that you can emulate the results that I receive with my clients, with about a 97, 98% success rate. But then again, I get to choose who I work with, which is a really big deal. So in any case, that's all I have for you for today. As always, I thank you for spending your time with me. Till next time. Bye-bye, all.